Today I'm gonna talk about Hydatid disease. This is our teamwork. Introduction. 40-year-old male patient complaining of abnormal pain and swelling. The clinical examination revealed a palpable mass with a thrill in the right upper quadrant of the abdomen. The ultrasonography confirmed a fluid-filled cyst in the right lobe of the liver, and elevated liver function tests were observed. The blood picture showed eosinophilia, and the patient gave a history of contact with stray dogs. Our topics: first, diagnosis, symptoms, importance of eosinophils, life cycle, treatment, and prevention and control. The diagnosis. Diagnosing Hydatid disease in its early stages is important because treating the disease is easier, and the doctor usually relies on the following methods to detect the disease. Conduct a physical examination of the patient and evaluate his medical history, making radiological images to determine the location, size, and shape of the Hydatid disease, such that one or more of these images are X-ray imaging where calcified cysts are easily visualized. Computed tomography, magnetic imaging, and ultrasound imaging. Eosinophilia and serological tests are ELISA and PCR. Symptoms. Commonly, Hydatid disease is asymptomatic and only discovered incidentally during imaging tests for other conditions and when the cyst increases in size, causing pressure on the surrounding tissue. When hydatid cysts grow in your liver, lungs, or other organs, they may cause blood stool, allergic reactions, or anaphylaxis, jaundice, nausea, and vomiting. If the cyst ruptured due to cough, trauma, or surgery, it causes fatal anaphylactic shock, seeding of the peritoneal cavity with scoliosis producing new cysts. Importance of eosinophils. Eosinophils contain granules that house various substances, including cationic proteins, enzymes, and toxic proteins. When eosinophils encounter parasites like Echinococcus, they release these granules, creating an environment hostile to the parasites. The cationic proteins and enzymes can damage the outer membrane of the parasites, contributing to their destruction. They recognize parasites through specific receptors on their surface that can detect molecules released by the parasites. Once they spot these intruders, they spring into action to eliminate them. In Hydatid disease, through the release of toxic substances from these granules, damaging the parasite's membranes and facilitating phagocytosis. This immune response is a crucial component of the body's defense against parasitic infection. Before talking about the life cycle, let's know a few about the parasite. The parasite is Echinococcus granulosus. It's a dog tapeworm, cystoda, equal flat segmented worm. It consists of scolex, neck, and 3 segments. The first segment is immature. The second one is mature, containing testes and ovary. The third is a graved segment and that has uterus filled with ova. The life cycle. This is the life cycle of the Echinococcus granulosus, where the egg is ingested by intermediate host. Then they convert into impregnated eggs. Then they move to the duodenum, then to circulation, then to liver, lungs, or any other organ. They convert, then form cysts, and the cysts may contain daughter cysts that may be ingested by dog, then the adult or the human may be infected from this dog again. Mode of infection. Man becomes accidentally infected by ingestion of the eggs. Infective stage, contaminating food or drink, or the hands after petting an infected dog. The hair is contaminated where the hair is contaminated with eggs. Conclusion. The preventive host is a dog. The intermediate host is a human. And the infective stage is eggs, and the habitat is the small intestine. Treatment. Treatment for hydatid disease depends on the size and location of the cysts. The most common treatments include medication. Small superficial cysts in one location may respond to an antiparasitic drugs like benzimidazoles, and benzimidazoles destroy parasites and shrink cysts. The Bayer technique uses a needle or catheter to drain the cyst. A parasite-fighting chemical is injected into the cyst before it's drained again. Surgery. Large, deep cysts may need to be removed with surgery, and surgical cyst removal involves removing part or all of the cyst or part of your liver. Prevention and control. Avoid eating or drinking anything that may have come into contact with dog feces. Have dogs dewormed by a trained veterinarian, not at home. Not have contact with dogs that may be infected. Not slaughter sheep or other livestock at home. Prevent dogs from eating infected sheep. Wash fruits and vegetables before eating them. Wash your hands with soap and water frequently, especially before preparing food or after handling dogs. If there is any questions, you may leave it as a comment. And thank you for watching.